Today we are examining Dr. Escaloni's knee, so stay tuned for the next episode, or rather this episode, of 50 Shades of Pain. Hi everybody, welcome to the 50 Shades of Pain show. I'm Dr. Danish Mazlamdoost, the medical director of Wellward Regenerative Medicine, and this is my co-host, Dr. James Escaloni.
Hello everyone.
Physical therapist extraordinaire and our movement biomechanical specialist. So James has been having some knee issues, and today we're going to take a look under ultrasound and examine his knee to figure out what's going on. This is a problem that's been going on for how long?
Almost 10 full years of progressively getting worse, limiting me more and more.
So I'm going to guess the audience is not going to hear that, because this machine is like a nuclear reactor with its noise generation.
Alright.
So,
let me say it again?
yeah, go for it.
I've been having this pain for 10 years and it's getting worse, and I can't do my squatting that I want to, I can't do my athletics, and I can barely do the wrestling with the kids. It's embarrassing to have a middle schooler pick me up and throw me down because I can't straighten out my knee.
Or embarrassing for me to be able to throw him down, too.
I mean, it is what it is. I want to be fixed.
For God's sake, James, you're like the Hulk with these pants. I mean, it was hard just getting these pants up. How much more muscle do you want?
Enough to protect me and make sure that my sons can't take me down at least until they're in high school.
That's a good point. Muscles protect our ligaments as we age, and our ligaments, as they break down, that's what causes us to develop arthritis. So keeping strong muscles means that we're going to have strong joints as we age. So go ahead, you were going to say something.
I was about to say, it's about time I get to the bottom of this because I'm a typical healthcare worker. We put everybody else first,
That's
and
true.
now's an opportunity for me to actually get a little bit of treatment for your all's benefit at home.
Yeah, and same with me. I do the same thing. If you scroll back a few months, one of the episodes was me actually getting an injection in my own hip and doing significantly better, rather.
I was jealous. I wanted that.
Yeah. So this is an ultrasound. It's what they use to see babies. There are no babies in here.
Oh. I want a knee baby.
The knee baby. And what we're using it for is, so everybody's familiar with x-rays, which helps us see bones. Everybody's familiar with MRIs, which helps us see soft tissue. Not a lot of people are familiar with ultrasound. The difference between ultrasound and an MRI is that this allows us to see things in real time. So I can actually look at something and stress his knee to see what impact it's having. And given the fact that he's awake and able to tell me where it hurts, he can actually pinpoint me or direct me to the area that's been bothering him, and I can take a look and see what's relevant there. And I can already see some issues here, James. The bone on the left, so let me get this going. There, right there. So that's the femur. That's this bone right here. And this bone is the tibia, which is the calf bone here. Here. Right, so it's this bone right here is the tibia. That's the one on the right side of the screen, and the femur is the one on the left side of the screen. And what's in between those two is the meniscus. You can see there's a little bit of a bulge here, but there's no tears in his meniscus, fortunately. However, there does seem to be a little bit of a tear in something called the coronary ligaments. Now, coronary, most people think sounds like heart, if you're familiar with medical terminology, but it's actually the ligament that wraps around the meniscus. And it's really important because it's kind of like an archway where if each brick is reliant on the next brick over, and if you take one of those bricks out, the whole thing collapses, and meniscus can be torn by that. In fact, this is often a precursor for a torn meniscus. The other component here to take a look at is the medial collateral ligament. A lot of people hear about that being torn, but fortunately, James, I'm not seeing any tears. There's a little bit of swelling in it, so the black around here is some swelling around your medial collateral ligament. You've got a little bit actually there. Is there any tenderness here, James?
A little bit when you poke there.
Yeah, so that's another big advantage of the ultrasound is that I see something and I can actually examine him and say, is that where it hurts? But I'm guessing that most of the pain that you have is right here. Let me find a finger spot. Right there.
Just a little bit more around there, yeah.
Yeah, you can see me moving on the screen there. Just barely moving there. That's a good one. That's what I'm pushing on. And that's where what I'm seeing is that tear right there with a little bit of swelling around it too. So it's evident this is an ongoing problem.
Oh yeah.
Yeah. So the other thing that we can do is actually take a look under a dynamic exam and see if the meniscus is holding. And you can see it's holding really well actually, James. So
I'm glad it's holding.
Yeah,
You see that dark spot right there moving.
Yep. So that's the meniscus coming in and out a little bit. But that looks fine.
Oh, good.
Yeah. So
Reassuring.
Even though this has been a long-standing problem, I think that it is not a very serious one on the inside. Now, I know you also have some pain on the outside, correct?
Yes, definitely.
Can you turn your knee a little bit? And so what I really wanted to see on this side is the biceps tendon.
The biceps muscles?
And there it is. So that round bone, you've got actually two bones in your calf. One is the tibia, which is the main one, and then the fibula is on the side. And that's where the biceps tendon comes in. Actually, if you can straighten your leg out, it's easier to see. There we go. So I can see the biceps tendon coming into the fibula, and it looks like, James, you've got some tears on the inside part. So
Definitely tender when you touch it.
Yeah, so this is tender right here, right?
Yeah.
Yeah. And let me turn on, I'm going to look at the blood vessels in that area. Tendons that have been injured for a long time start to develop blood vessels inside of them. Yeah.
That's good though. It means it gets nutrition, right?
No, actually, because you don't want those scars to get fed with nutrients, because it will perpetuate that scar as opposed to breaking it down.
Sounds like we got to break it down to build it back up again.
That's right, yeah. So there's a little bit of, you see the pulses right there. Those are blood vessels. And it does look like there's a little bit of blood vessels moving into that area. So yeah, again, that demonstrates how long this has been going on, and the fact that it doesn't matter how much you exercise it. I think this would be a problem that continues if we didn't do something more aggressive, like doing a prolotherapy or even a PRP to fortify those fibers and suck out or break down some of the scar tissue, and then we want to just needle into that to disrupt some of those blood vessels and give it an opportunity to break down those scars.
Well, 10 years has been way too long.
Yeah, that's
so
right.
I'm all about doing something.
Well, stay tuned then. Next week, what we'll do is come back and actually do an injection to Dr. Escalone's knee. We'll do a prolotherapy. Is that all right with you?
A live injection for you guys to watch me scream like a little baby? Why not? Let's do it.
That's right. I'll be extra gentle with him.
No, you won't.
No, I won't.
right.
Well, thank you for tuning in to the 50 Shades of Pain show, where we try to we empower patients with knowledge that helps demystify pain and give you the knowledge you need to get your pain on a track to recovery. Look forward to talking with you again.
I'm Dr. Escaloni. I'll see you next time.
And I'm Dr. Donish. Bye.